Hi everyone, today we are going to talk about the elimination and eradication of communicable diseases, in particular what the current stage of knowledge on these communicable diseases are. To begin, what is a communicable disease? A communicable disease is an infectious disease that is transmittable from person to person through direct contact via kissing, touching, sexual contact, oral secretions, body lesions, or through indirect contact such as airborne, vector, fomite, and droplet transmission. Communicable diseases can be from many microorganisms such as bacteria, viruses, parasites, and fungi, and when spread through human contact, can cause many detrimental effects. So, what does it mean to eliminate a disease? The elimination of a disease means that there is a reduction to zero cases of that disease or infection in a defined geographical area, such as a country or even a continent. However, the microbe may still remain in circulation, but it may not make you sick or there are no clinical manifestations. In contrast to eradicated disease, refers to the permanent and complete worldwide reduction to zero new cases. The only disease currently eradicated worldwide is smallpox. So today we are going to take a deeper look into smallpox to see how exactly this medical accomplishment was achieved worldwide. Smallpox is a deadly viral disease that has killed over 300 to 500 million people worldwide in the 20th century alone. Cases of smallpox have existed for 10,000 years, dating back to 8000 BC. It is an airborne illness that affects the skin cells, spleen, lymph nodes, and bone marrow within the body. The symptoms associated are frequent fevers, vomiting, and rashes, and nearly 30% of those who are infected die within the second week of infection. Those who survive, however, are left with blindness and with permanent scars throughout their life. It wasn't until 1022 that there was progress of controlling this disease. A monk who lived in Sichuan, China, developed the first method of variolation. Variolation is where smallpox ingredients was being broken down and being nasally inhaled to produce immunity. As a result, majority of those inoculated would survive, however, nearly 3 to 5% would still die. A significant figure, Edward Jenner, as many of you may know, put forth a concept that involved a cowpox strain. He noticed that people who developed cowpox were not susceptible to the smallpox strain, and since they're from the same family, he figured out he would be able to use the cowpox to help those affected. Therefore, he tested this theory out by using the scrapings of cowpox to infect a little boy named James, to determine if he would still be able to catch smallpox disease. After the boy recovered, Jenner inoculated the boy again with a fresh sample of smallpox, and as a result, he showed no signs of the deadly disease. Towards the end of this vaccination production, large vaccination campaigns began to develop that used less viral proteins of the smallpox family to ensure that people were immunized and eventually leading to the eradication of smallpox. In 1959, the WHO started a plan to rid the world of smallpox by starting a campaign. Unfortunately, it lacked funds, the personnel, and commitment from countries. This particular vaccine needed to be cooled in a refrigeration, so it was hassle for some countries to retrieve. In 1976, another program began called Intensified Eradication Program. This program aimed to develop a better needle, called a bifurcated needle, as well as a surveillance system to detect and investigate cases and mass vaccination campaigns. Overall, the benefits of disease elimination and eradication can build more sustainable healthcare systems globally. Being knowledgeable on the concept of vaccinations is important on how we address other viral diseases around the world. Therefore, for each disease an area is faced with, the precautions that are taken can ensure that there is always a possibility in controlling a disease. Public health initiatives should be an important part in targeting specific regions and how each geographical place can take precautions in reducing prevalence rates globally. Smallpox has been eradicated for two main reasons. The first one is that focused surveillance allowed for new cases to be identified quickly. Secondly, ring vaccination, which meant that anyone who is suspected to have been exposed to smallpox is tracked down and vaccinated as soon as available. These measures aim to reduce the amount of spread of smallpox. Furthermore, smallpox had the tendency of lifelong immunity, so a person who has become infected or vaccinated will rarely ever get it again. Additionally, smallpox is a good candidate for eradication because the disease is highly visible due to the popular rash that was associated with it. Only humans were the transmitters of smallpox, unlike diseases such as yellow fever that could be transmitted to monkeys. This would therefore mean that even if the entire human population vaccinated against yellow fever could still remain and slip back into humans if immunity were to fail. Smallpox was eradicated in North America, Europe, South America, Asia, and Africa, but it was not until May 8, 1980, where the 33rd World Health Assembly declared the world free of this disease, marking the biggest achievement in international public health. The variola virus is stored and stocked in various countries under WHO supervision by the CDC in Atlanta and the State Research Center of Virology and Biotechnology in Koltsovo, Russia. Diseases that are likely to follow are polio, measles, and diphtheria, among many others. Polio is a difficult disease to eradicate because there are not many recognizable symptoms that a person can notice and treat immediately. Measles is also problematic due to its time lapse of exposure to the development of its most common sign, which is a rash. A current disease that we're going to talk about is measles. Measles has been seen immensely in the media as of recent. It is a highly contagious disease and can be spread through breathing, coughing, or sneezing. This disease is more prominently severe in infants and those who are malnourished or immunocompromised. Measles is a controllable disease if treated seriously. 2 doses of the MMR vaccine is almost 100% effective in preventing the presence of measles in an individual. Most of the cases in North America come from travelers who come back from vacation in different parts of the world. African and Asian countries are the most affected due to the fact that their health infrastructure isn't as good as North America. So we must know, what can travelers do to prevent measles? Firstly, it is important to make sure you are fully vaccinated before going on vacation. The measles, mumps, and rubella vaccine, or the measles, mumps, rubella, varicella vaccine, are usually given in childhood. The first vaccine is usually given to children between 12 to 15 months of age, and the second vaccine is usually given before entry to elementary school. The vaccination schedules vary depending on the province or the territory that you live in. For this current issue and disease, we are currently trying to continue vaccination efforts and ensuring that people are educated prior to going on vacation. The disease is relatively controlled in North America, with 110,000 people who died from measles in 2017. If you take a look at the chart in the presentation in the rightmost column, you could see the percent prevented through immunization. Smallpox has a 100% prevented rate, whereas diphtheria has a close 86%, as well as polio. This shows that many diseases are close to being eradicated or at least eliminated in geographical locations. Next, we are briefly going to take a look at the benefits to elimination and eradication. The first and probably most obvious one is that there would be a decrease in prevalence and mortality. Secondly, there would be a reduction in the amount of stress and an improved quality of life. Furthermore, herd immunity would be an important part for people who cannot get immunized due to allergies or other medical conditions. Finally, and probably one of the most important economic factors, is that the eradication of diseases means that there would be less money spent in healthcare to support patients with these diseases, and less money spent on the vaccination process. To put this into perspective, the United States alone would reduce $270 million a year that is currently spent on the polio vaccination process. Overall, the benefits of disease elimination and eradication can build more sustainable healthcare systems globally. Being knowledgeable on the concept of vaccinations is important on how we address other viral diseases around the world. Therefore, for each disease an area is faced with, the precautions that are taken can ensure that there is always a possibility in controlling a disease. Public health initiatives should be an important part in targeting specific regions and how each geographical place can take precautions in reducing prevalence rates globally. We hope you enjoyed our presentation and thank you for listening.